Good afternoon. How's everybody doing? Can you hear me in the cheap seats? Doing okay? Good. All right. A couple of housekeeping things. You guys had a conclave last night, is that correct? And you had 5 new fellows: Dr. Douglas, Darwish, Jaffe, Scovison, and Rose. Are you guys here? Anybody here? Nobody's in the room to stand up and catch an applause? What's up with that? Wow. Okay. Dr. Peterson, I hate computers. The technology is going to come alive and kill us all. If you're a StarNet fan, if you're, a Schwarzenegger fan for Terminator, computers are going to get you every time. So, thanks a lot for allowing me to share some time with you today. I bring you greetings from Kevin Clower, who is the CEO of the AOA, President-elect Ira Monka. It's an honor to serve as your AOA president. And got to tell you, I'm proud to be a DO. So that said, this won't hurt a bit. I promise. Little poke. And if you can count backwards from 100, we'll get started. So, see if I can get my technology working here. The green one? Not the red one? Yes. Got it, okay. So each year following the AOA's annual business meeting in July, the AOA leadership convenes to develop a blueprint for the year ahead. We determine how we can best work together to advance the AOA and the osteopathic profession, where we can make the biggest impact, and how we can best serve our community of DOs and the osteopathic medical students and patients. So we're going to start with building a better future by inspiring the youth of our profession. We want to promote AOA board certification as the premier certification pathway for all osteopathic physicians. We want to continue to expand and improve service to our AOA diplomates, expand outreach in osteopathic medical students, residents, and fellows regarding the distinctive practice of osteopathic medicine, as well as build and promote the osteopathic profession for future generations of DOs and osteopathic medical students. So my tagline is honor the profession. Ensure membership engagement through enhancing service to our members, wellness toolkits, CME reporting, and the new My AOA app. So measure and track member engagement with AOA programs to help us in our services and our membership. Provide longitudinal member satisfaction survey. The new one will be coming out probably within the next year. And to continue to develop and enhance the unique value proposition for osteopathic medical students, residents, and fellows. We also want to expand the AOA's voice to broaden our influence in the healthcare community, enhance relationships with non-osteopathic organizations like the AMA and the AAFP, impacting or influencing the osteopathic community. Explore opportunities for collaboration and joint programmatic development with such organizations, and support efforts for DOs to assimilate into the overall physician community while preserving the distinctive practice of osteopathic medicine. Busy slide, but some recent stats with you that demonstrate the growth of the profession, which leads to greater opportunities, awareness, and influence for DOs in the healthcare community. According to the AOA's latest osteopathic medical profession report released this past July, we now have more than 178,000 osteopathic physicians and medical students, which is a tremendous uptick. It's an 800% increase over the last decade. 57% of DOs practice primary care, 43 are going the other direction to specialties. Anesthesiology is doing a great job. We're seeing more into neurosurgery, orthopedic surgery, and neurology. Bright future for postdoc trainees, record-breaking match. 7,049 DO students and grads matched into PGY1 positions with a 7% increase over the last year. We matched across 41 specialties, the most ever recorded for DOs on match day, and broke an all-time record for the military match. We're making inroads. Osteopathic recognition, Dr. Deppa touched on this a bit. This provides no-cost assistance for training programs seeking osteopathic recognition. There has been some headwinds in this program. recognizing a resident's commitment to osteopathic principles and practice through training in a program with osteopathic recognition. The problem is that we as a profession have to get to the program directors to buy into this program. Those are the headwinds. Establishing board certification as the certification choice for DOs, showing an 80-year tradition in excellence. Our primary goal is to make AOA the preferred certification choice for all osteopathic physicians. We're talking about reciprocity. Dr. Deppe touched on it briefly. I'll come back to it in a minute. Early entry pathways he also touched on. Longitudinal assessments for OCC, and more remote exams, which is a cost savings to the test taker. Continuing medical education, joint partnership. The AOA is an ACCME accredited provider with on-demand OMED content. Learning management system, the AOA online learning services available for osteopathic organizations without a learning management system. And osteopathically distinct CME task force representatives from AOCED, SOCI, and other CME sponsors have put together a wonderful program. New virtual meeting platform got tuned up with OMED of last year, as well as DO Day recently this past spring. This fosters a community of experience through hybrid immersion events. Talk about advocacy for a minute, both federal and grassroots. State government affairs. We are the profession that represents the interest of all osteopathic physicians, regardless of specialty or practice type, at the federal and state levels, ensuring that your voice is heard and lawmakers understand the distinctive approach that DOs bring to the healthcare community. The Dr. Laura Breen Healthcare Provider Protection Act, Medicare cuts, physician payments, and health information technology are also regulatory affairs that have come under scrutiny. Congressional affairs with prior authorization reform and Medicare Advantage, surprise billing, as has been touched upon recently, liability protection, and debt relief. Grassroots access to care, entitlement reform, regulatory reform, as well as scope of practice and physician workforce issues, as we touched on. Boy, this is really cool. My talk is going to be cutting short here. This is pretty cool. Legislative overview, we talked about that briefly. I don't need to redo it here. We're a little stressed on time, so we'll kind of blow through that if that's okay with you folks, unless you want to talk about legislation. No? Okay. House of Delegates, 134 resolutions were considered, 125 resolutions were adopted. Highlights include 11 bylaws uptakes, Comlex USA licensure examination to be considered equivalently, certifying residents for board eligibility. These resolutions will be reviewed and categorized as policy or action. Nice picture of our House of Delegates officers, Dr. Broder and Dr. Morrison. OPAC at the House of Delegates. OPAC raised more than $171,000, which is an increase of $40,000 from the previous record, a 31% increase. Fundraising competition between the state delegations helped increase the amount raised. And we have a nice picture of Dr. Teresa Hupka, who's an OBGYN from Chicago, was nominated to the OPAC board as a member at large. Talk about professional advocacy, combating misinformation and correcting inaccurate representations of DOs, calling for transparent use of professional designations. I don't know if it makes you crazy, but I get crazy with PAs wanting to be called assistant physicians, anesthesiologists being malaligned with nurse anesthesiologists. Thank you. This gives me heartburn. So we're advocating on behalf of DOs and osteopathic medical students who encounter discrimination. I got an email and a phone call about 2-3 weeks ago from a physician in California who's running a training program who cannot get DO students to come into California for audition rotations because the state of California is mandating not a training license, but a full unrestricted license to come in as a medical student to train. What are they thinking? Unreal. Public health initiatives. These are very busy slides. So topics include flu prevention, vaccines, social determinants of health, and the list goes on and on. We have an osteopathic brand campaign. Phase 1 was a multi-channel, multi-year campaign from July through December of last year, resulting in 53 million impressions across print, digital, streaming audio, and television in selected markets. Hashtag, no, I lied, www.findado.org is the website, and it's a good place to spend a little bit of time. Osteopathic Pride campaign, hashtag DOProud. Join the collaboration on the AOA social media channels at osteopathic.org, DOProud. AOA's commitment to diversity, equity, and inclusion. This is a big deal, folks. The AOA has taken a direction to develop and maintain an inclusive workplace environment that welcomes and incorporates diverse perspectives and backgrounds at all levels within the organization. Create processes and programs to ensure our physician leadership are reflective of the osteopathic community and more broadly reflects the populations that we serve. Demonstrate the organizational impact of diversity, equity, and inclusion with our professional community, membership, leadership, and workforce. Communicate our progress with internal and external stakeholders. Physician wellness resources. Caring for patients is your top concern, and as I said in July, caring for you is my top concern. It's more important than ever to develop time for your own health and wellness. Tools you can use are found at osteopathic.org/physician-wellness, on-demand wellness webinars, AOA member discounts on wellness apps, COVID-19 wellness resources, substance abuse and mental health services. Let's talk a bit about COVID. Show of hands. Who had COVID? Show of hands. More than once? Yeah, how about it? So did we get boosted? Okay, not too bad. Anybody hospitalized? Okay. So pay attention, take care of yourself. Let's stay connected. Download the mobile app, www.osteopathic.org, mobile-app. Save the date for OMED 22, October 27th through 30th in Boston. I understand the college is not participating, is that correct? College is not coming to OMED? Not this year? Or you are? You're not? Can we talk about next year? Sorry. Thank you. Questions? No heartburn. I got you back on time. Thank you very much.